Welcome back to the Now Morning Show, just shy of 30 minutes past the hour of 7 o'clock. And joining us now is no stranger to the show. Dr. Paul Crooks, Media Liaison, joins us to talk about a controversial topic and one that is close to many people's hearts, the malicious poisoning of animals in Trinidad and Tobago. Good morning, Dr. Crooks, and welcome.
Good morning. Thank you for having me.
It's a pleasure to have you on the show this morning. How are you doing today?
I'm doing very well. Thank you very much.
Well, let's get straight into the conversation. I'm glad you're doing well. This is a conversation, though, that, to be quite honest, can be heartbreaking for many and begs the question of legislation also. Let's first get into malicious poisoning in Trinidad and Tobago and specifically what the definition is.
So poison is the ingestion of a substance where a small volume or a small concentration can cause very deleterious effects to the body. So we're not talking about something where you have to consume very, very high volumes. Like even water is poisonous, right? There's a saying that any substance is poisonous depending on the volume. Everything can have severe negative effects on the body if taken in huge volumes. But we're looking at typically substances that are ingested in very small volumes and ingested because we are not looking at like a snake envenomation where a snake bites someone. That's a totally different thing. A poison is ingested. And in Trinidad and Tobago, unfortunately, it is a very, very common occurrence that animals, domestic animals and wild animals, succumb to malicious poisoning.
Now, let's break that down, particularly the term malicious. We see people doing it, of course, with ill intent. From your experience, do you see a high rate of malicious poisoning, and what are the reasons why?
Nearly every case of poisoning that we've seen here in Tobago at the Tobago Animal Hospital has been malicious poisoning, with the rare exception when there's accidental poisoning of someone's own pet or livestock as a result of attempted malicious poisoning, which is very terrible to say. But for the most part in Tobago, and with my experience, the malicious poisoning has been as a result of livestock farmers primarily attempting to reduce the losses that they suffer as a result of dogs attacking their animals. So usually the case here in Tobago is you have somebody who has maybe 10, 20 sheep, and then a pack of dogs comes in. And of the 10 or 20, they maybe lose 5. And the farmer says, you know what? I can't put up with that anymore. These losses too high. Nobody claims ownership of these animals. I'm not being compensated. And so they get some sardines and they do their thing and they lay them around. And as you drive around the neighborhood or you investigate the area around which the poison was placed, you tend to see dead bodies everywhere. I mean, you see dead dogs, dead chickens, dead doves, and it's a really, really, really unfortunate situation that is all too common here.
Why do you think this is the go-to, well, in parentheses, solution that is chosen by individuals? Is it that we don't have the, necessary things in place in order to deal with these situations?
Recently, I'll answer that by this. Recently, there was a meeting of NGOs along with a government panel regarding animal welfare. And that talk, that was about 2 or 3 days ago, and that talk was primarily centered on the control of the stray dog population. Ultimately, in the case of the livestock, that is what it comes down to, the control of stray and roaming dogs. Now, we know that in Trinidad and Tobago, the last time I was on, I believe we talked about the importance of spaying and neutering, but in Trinidad and Tobago, there are many owners who do not spay and neuter their animals. And there are many reasons culturally, traditionally, why people choose not to spay and neuter. And of course, financial is an aspect as well. People try to help the dogs and the cats in the neighborhood, but they don't actually have the funds to afford to care for them in the appropriate way. So they end up feeding the animals, but they never take the animals to be spayed or neutered. So you have an increasing stray animal population. People get puppies, they get kittens, they have no idea what to do with them. So these numbers just increase. Of course, we have risks to public good. We have dispersal of garbage, dissemination of garbage. We have road traffic accidents and so on. But the destruction to wildlife, the destruction to livestock is where primarily we see this malicious poisoning attempt. And it's that people feel that this stray animal situation is out of control and beyond their control. And that tends to be the reason why people go that route. It's a relatively cheap and accessible route, but also a very risky route and one that we discourage. Absolutely. There's no circumstance where the vet association or me as an individual, any vet, would encourage the use of poison where there are alternatives. And there are alternatives. It's just that they're costly, and we need to have intervention by the larger NGOs, maybe even governmental support, as the meeting presented 2 days ago, 3 days ago, would have highlighted.
Dr. Crooks, aside from what you would have mentioned, of course, speaking about the stray population in Tobago, are other animals at risk, or have you seen them become victim to malicious poisoning?
Absolutely. And here's the thing about malicious poisoning. So you have a poisonous substance, which I don't want to name. Every farmer in Tobago probably knows what poisonous substance is commonly used here. In Trinidad, there may be different poisonous substances used, as well as many farmers here know how to get that substance.
So
I don't even want to name it.
So before we get into that, then I wanted to ask about that. So these agents that are used for malicious poisoning, is it that they're not controlled? They're easily available in the markets?
Unfortunately, yes.
Okay.
That is the reality. And because these drugs, these chemicals are widely available, because they are relatively cheap, given their efficacy in what the farmers are trying to do generally. Because they're relatively cheap, this is why farmers go that route. They try to find a cost-effective way to cut their losses. And this is what they've ended up on. And that tends to be the rationale or the reason why they do it. And what happens is, of course, when you put a poisonous substance down in an environment, you are not only going to poison your target species or your target animal.
Okay.
And that is where we end up with situations where even people are exposed to poison. And we're here in Trinidad and Tobago, we're still really pushing to see animal welfare be made a priority. Human welfare, I think most people would argue, is incredibly important. And you don't want to know that you put your poison out there and a child is playing, as the summer holidays, a child is playing, sees this can of sardines on the side of the road, picks it up, sniffs it, puts their finger in their mouths, whatever might happen. And then this child is exposed to this poison because you were trying to kill a dog. There's no way that that could be okay. And unfortunately, it happens quite a lot.
And so this is a conversation that we definitely need to explore further when it comes to the possibility of maybe legislation, because you did mention this is a substance, or some of these substances that are used are readily available. Is it that it is possible, or maybe we need to have a review as to whether or not these should actually become controlled so that we avoid things like this happening in the future?
Yes, we should. And in some other countries, these chemicals, they're still available, but you must be a registered farmer to access them. You must present that you are registered. So you have to present that at the time of purchase, that you're a registered farmer, as well as you have to justify for the use of these drugs. You have to be able to account for how much you use, why you use it on your farm records. Because the drug is so highly toxic and highly controlled, you must be able to account for it.
And are there any antidotes for this particular type of poisoning? Do you have any stories where you've been able to save animals?
Yes. So there are antidotes, but with treatment of cases of poison, there are many, many factors that determine the outcome. So I guess from movies and so on, pop culture, we think of antidotes as something that almost magically fixes something. Somebody's on the brink of death and they drink this little vial and now they're back to normal in 2 minutes. That's not really how it works. An antidote just counters the effect of the drug. Some drugs have such long-lasting effects that even though we counter the effect now, we just prevent the animal getting worse. Some antidotes do actually reverse the effects where the drugs are reversible. So there are two common poisons used, one for rodents primarily, and that has typically a much longer time to effect than the other poisons. So the one used for rodents, that has an antidote, but also the animal that is exposed needs to be treated as soon as possible after exposure. There are times where dogs accidentally ingest rat poison because the owner was going to put it out and the bag fell off the table and the dog comes in and eats it. We've heard about that so many times. So in those instances, yes, there's an antidote that is very effective at preventing any signs of illness once intervention is timely. The other more common poisons that are used here in Tobago, those also theoretically have an antidote, but the exposure, the animals can just inhale the drug and walk a few steps and die. There was an instance where I saw the poison put down in a yard, and while I was there examining animals, a chicken walked over to the poisonous substance, ingested it, and the chicken literally walked about 10 feet before it collapsed. And then it started having seizures and died. And I'm talking in 15 seconds. And it just pecked once at the area. So we are looking at extremely lethal, extremely toxic drugs and compounds that when used in such a case and when the animal ingests a small amount, we don't even have time to intervene. So yes, there are antidotes, but it really depends on the dose. It depends on when the animal is presented. But generally, we really advise against it.
Dr. Crooks, we just have a few moments left before we wrap. Any recommendations and closing comments for Trinidad and Tobago on this topic?
Yes, please. Thank you very much for that. We ask that instead of going this route, I understand for farmers that it can be frustrating. I understand that people in the Caroni Bird Sanctuary are seeing the bird populations decrease significantly because of wildcats. And I know it can be frustrating. There's a lot of work to do, and there are people who are trying to get that work done. So please reach out to a non-governmental organization, animal welfare group, the Trinidad and Tobago Vet Association. We are trying to implement programs to ensure that we can reduce the stray animal population, reduce the impacts on wildlife, and reduce the impacts on livestock. So please reach out to us, reach out to your vet. Just have a conversation. Start there. What are the recommendations? How can we work together to try to ensure there's limited loss of life and limited risk to the environment and to wild animals, as well as livestock owners? Please ensure that your animals are fenced. I know it may not feel like it should be your responsibility because the dog should be fenced, but if they are stray dogs, the responsibility really comes down to the livestock owner to ensure that your livestock are protected.
And Dr. Crooks, thank you so much for that, and thank you for joining us. Have a wonderful day.
Thank you very much.
Dr. Paul Crooks joining us this morning speaking about malicious poisoning in Trinidad and Tobago. Stay tuned. There's more coming up after this break.